Hi, my name is Mallory. I'm going to be your nurse today. I'm just going to go ahead and wash my hands here, and I'm going to be performing a neurological assessment on you today. Can you please verify your name and date of birth?
Tyler Garza, 8/23/1992.
Very good. That says it on your bracelet. I just want you to know that everything that happens in here is confidential. Are you comfortable?
Yes.
Okay, and if you have any questions throughout, just let me know, and I will answer those for you.
Okay.
So I'm going to go ahead and drape you to keep your privacy here. All right, so the first thing I'm going to do is test your cranial nerve 1, and that would be your olfactory, which is your sense of smell. So I want you to cover one nostril, and I want you to breathe in and breathe out. Okay, and that's good. And then cover your other, and breathe in and breathe out. Good. Now I want you to close your eyes, and I'm going to weigh the scent in front of you. I want you to cover one nostril, and then I want you to tell me what it is.
Coffee.
Very good. Okay, and then cover your other nostril and smell.
Peanut butter.
Yep, very good. Okay, now I am going to test your cranial nerve 2, which is your optic nerve. And normally I would do the Snellen chart, which would test your far vision, but we don't have one, so we're not doing that today. I would also do a Rosenbaum test, which would test your near vision, and we cannot do that either. And then I would dim the lights and do the ophthalmoscope test, which we also can't do. So then I'm going to jump into your visual fields test. Okay, so I'm going to wiggle my fingers in various spots, and I want you to say now when you can see them. So
now. 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 Now.
very good. Okay, and the next thing I'm going to do is test for your cranial nerves 3, 4, and 6, and those are your oculomotor, your trochlear, and your abducens. Okay, and for this, first I'm going to look for ptosis, and that's just kind of the drooping of the eyelids. I'm going to look at your eyelid position. So just look straight ahead. I'm noticing your top eyelid is between your iris and your pupil, which is good, and your bottom is resting right at your iris, which is also normal. So your ptosis would be a negative. And then now I'm going to kind of shine a light in your eyes and just kind of like see how your pupils react, and I'm also going to see what size your pupils are. So just look straight ahead, and your pupils are at a 3 right now. And I'm going to go ahead and shine the light in your eyes, and I'm looking for reactiveness. Good, and the other side. And your pupils are constricting like they're supposed to, and your other pupil is constricting when the light is in it, so they are reactive. Your pupils are round. Very good. Now I'm going to do what's called accommodation, and I'm going to bring my pen in and out, and I want you to follow it, okay? So here we go. Do it one more time, and your accommodation is good. The next thing I'm going to do is the positions test. So I'm going to hold my pen here, and I want you to follow it, okay?
Okay.
So very good. So your eyes are following like they should be, equally bilaterally. And then I'm going to do the cover-uncover test. So this is just kind of checking to make sure that one pupil is dilating the same while the other one is covered. So just kind of look past me, and I'm just going to cover and uncover. And your pupil is dilating and contracting the way it should be. Very good. So next is cranial number 5, cranial nerve number 5. And that is the trigeminal, and I'm going to be testing for some sensory on your face. So I want you to close your eyes, and when you feel a light touch, I want you to say now.
Now. Now. Now. Now. Now. Now.
Very good, and you felt the light sensation bilaterally equally. And then now I'm going to do a sharp dull test. So I want you to tell me when you're feeling sharp sensation or dull sensation.
Okay.
I need you to close your eyes again for this one. So
Sharp. Sharp. Dull. 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 Sharp.
very good. And then I also need to inspect your temporal and your masseter muscles, so I need you to just punch your teeth for me, please. Very good. And I see that your muscles are moving. Are you having any pain or tenderness with that?
No.
Very good. Okay, so now I'm going to do cranial nerves number, okay, hang on. I did 5. I already did 6. Okay, sorry. I'm going to do cranial nerve number 7, which is your facial cranial nerve. And this, I'm going to have you do some funny things. So I want you to go ahead and smile and frown and purse your lips. And I want you to wrinkle your forehead and puff your cheeks out. Very good. I'm going to have you raise your eyebrows and close your eyes. And I'm going to try to open your eyes. Don't let me. Very good. And I would also do a taste test on the outer 2/3 of his tongue, but we're not doing that right now. Okay. And then I'm going to do cranial nerve number 8. And that is your vestibulocochlear nerve, and it's testing for your hearing. So I'm gonna have you sit in this chair. You can bring your drape if you'd like, or whichever you want to do. Okay, and this is where I'm testing for your hearing. So I want you to cover one of your ears, and I'm gonna cover my mouth with a card, and I'm gonna whisper a 2-syllable word, and I want you to repeat it, okay?
Christmas tree.
Okay, and cover your other ear.
Light bulb.
Very good. And now I'm gonna do what's called a Weber test with my tuning fork. And you're gonna feel a vibration. I would hit the tuning fork and you would tell me, I need to know where you feel a vibration if you feel equally on both sides. Do you feel it equally on both sides?
Yes, I do.
Good. And now I would touch it to your bone right behind your ear, and I'm gonna time your bone conduction, and I want you to tell me when you no longer feel your vibration.
Now.
Okay, and I want you to tell me when you no longer hear it.
Now.
Okay, and we're going to do the same on this side.
Now.
Okay.
Now.
All right, and that was the Renee test, and that was just testing your bone to air conduction, and your air conduction was twice the amount of your bone conduction, so that is normal. Okay, and now we're going to do cranial nerves 9, 10, and 12, which are the glossopharyngeal, the trochlear, and the hypoglossal. And so the first thing I need you to do is I want you to swallow. And are you having any difficulty swallowing?
Nope.
No. Good. Okay, and then I'm going to put gloves on, and I'm going to take a look inside your mouth. Okay, I'm going to take my tongue depressor and my pen light, and I want you to stick your tongue out and say ah, please. Okay, and I notice that your soft palate and your uvula move up when you say ah, which is normal, so that's good. And then I'm going to check the range of motion of your tongue. So I would like you to stick your tongue out and pull it back into your mouth, just retract. And then I want you to stick it out again and move it side to side. Okay, and then I need you to put it on the side of your mouth. Very good. You have full range of motion of your tongue, which is good. And then I'm going to do cranial nerve 11. So we need to go back on. Wait, hang on a second. No, okay. We're going to do the motor function first of your cranial nerve 11 is, go ahead and stand up, is your spinal accessory cranial nerve, and we're going to test for your cerebellar. And so here we're going to do gait. So we're going to start back here. And I want you to walk to the edge of that table and then walk back. And I'm just kind of looking at your stride, which is normal. Your arms swing in opposition, and you are steady. And then now I want you to do tandem walking, which is kind of like how they do heel to toe, kind of like a sobriety test. So come all the way up here. And then turn around and walk back. And you are steady, you're not falling over, which is good, and you can walk in a straight line. Okay, now I want you to walk on your heels there, and then on your toes back. Very good. On your toes back. Good job. And then I'm gonna have you stand right here facing the TV. I'm gonna put my arms around you. We're gonna do the Romberg test, and I want you to just stand there, and I'm gonna time you for 20 seconds, and just gonna make sure you're not swaying. Okay, and now I want you to close your eyes and just still stand there. I'm just kind of looking to see if you're going to be swaying at all for another 20 seconds. Okay, you're good. Okay, now I want you to hop on one foot, please. And then hop on the other foot. I forgot to put the number at the beginning of the... My number is 35. Right. And I don't have my tag on. I need a pen. Crap, yeah. Okay. We don't have time to redo this. My number is 35, and I just forgot to write it down. Here it is. Okay. Okay, so I had you hop on one foot. So now we're going to test for coordination, and I'm just going to have you, actually, we'll just sit here. That's fine. Okay, so now I want you to touch your hand to your nose 3 times each, so just count to 6. So 1, 2.
1.
Keep your eyes
2,
open.
3, 4, 5, 6.
Okay, and then I want you to do the same thing with your eyes closed. We're just testing your
1,
coordination.
2, 3, 4, 5, 6.
Okay, and then also I want you to touch your fingers to your thumb. And I want you to go back and forth as fast as you can. All right, very good. And then I'm also gonna have you do the thigh pat, alternating the bottom of your hand to the top of your hand, and go as faster as you go. Very good. I'm gonna have you lay back, and I'm gonna have you do the heel to shin test. So we're just still testing for your coordination. So legs straight out. I'm gonna have you take your heel and put it right here, and push it all the way down to your foot. Okay, do the same for the other. Okay, very good. I'm gonna have you sit up, and we're gonna do. We're gonna do sensory, actually. So I'm gonna do the, kind of like what we did earlier, I'm gonna do the light sensation. I want you to say now when you feel my cotton ball, okay? And I'm gonna have you close your eyes.
Now. 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 Now.
Okay, so on your upper and lower extremities, you feel light sensation equally bilaterally. So I'm going to do your chest and your back, which is your anterior posterior thorax. Once you close your eyes, I'm going to do the same thing.
Now, 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 now.
Okay, and now I'm going to do sharp and dull. And I just want you to tell me, like earlier, whether you feel sharp or dull sensation. Okay, so
Sharp, sharp, dull, sharp, dull, sharp, dull, 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 sharp, sharp, dull, sharp, sharp, dull.
okay, and I'm gonna do the same. Oh, so, okay, so your upper and lower extremities can feel sharp and dull sensation equally bilateral. And I don't think I verbalized that on your anterior posterior thorax you felt light sensation in both. So then we're gonna do this on your chest and your back, your anterior and posterior thorax. So
sharp, sharp, dull, dull, sharp, sharp,
Very good.
sharp, sharp, dull, 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 sharp.
Very good. So you feel sharp and dull sensation both on your anterior and posterior thorax. So now we're going to do a vibrations test, and I'm going to have you close your eyes, and I want you to tell me when you no longer feel vibration. Okay, so we're going to do this right here on your radius.
Now.
Very good. I'm going to do this on your other one.
Now.
Very good. I'm going to do the end of your index finger.
Now.
Very good. And the end of your other index finger. And I would normally be doing this with a tuning fork.
Now.
Very good. And then your medial malleolus.
Now. Now.
Very good. And then your greater toe.
Now.
Very good.
Now.
Very good. Okay, so you can feel vibration in all the correct areas. So now we're going to do the oh my gosh, the stereogenosis test. So I need you to close your eyes, and I'm going to put familiar objects in your hand, and I want you to identify what they are.
Okay.
So close your eyes.
Screw.
Very good. And then the other one.
A coin.
Very good. Okay, and then I'm going to do the graphesthesia test, and I'm going to write a number in your hand, and I'm going to have you tell me what it is, okay? So
4.
very good. And we're going to do it in this one.
8.
Very good. Okay, and now I'm going to do a localization test. So I'm going to have you close your eyes. I'm going to touch you in various spots, and I want you to point to where I'm touching you. Okay, so. Very good. Okay, good. I'm missing something. It's like the sun's. I don't know. And I would also check for temperature at this point, but we're not going to do hot and cold. So now we're going to move on to your reflexes. I feel like I missed something, but I don't remember what I missed. Okay, so first we're going to check for your tricep reflex, and I want you to just let your arm dangle in my hand, just dead weight, and I'm going to tap here. Good, and I'm just looking for just like a jump, and I would rate that reflex from 0 to 4 at a 2+, and we're going to do the same here. Very good. I'm going to check your bicep reflex, and I'm just feeling for this tendon here, and I'm going to tap. And I saw a contraction and flexion in your lower muscle here, and I'm going to do the same over here. Good. And then I'm going to do your brachioradialis, and I'm just going to tap here. Yep, and I saw your hand kind of jump, and I'm going to tap here. Good. And so those reflexes would be a 2+. We're going to do your patellar reflex. And so, good. We're going to do it here. Ooh, right there. Good. Okay, and then we're going to do your plantar reflex. So I'm just going to kind of, good. Oh, this isn't plantar. This is your Achilles reflex. Sorry, I misspoke. And your foot just kind of jumped, and that's good. Those would be a 1+ each. Okay, and then now I'm going to do your superficial. Those were your deep tendon reflexes. These are your superficial. So I'm going to just kind of drag this on the bottom of your foot, and I'm looking for your toes to curl in. We wouldn't want them to fan out. That's more for a baby. So I'm just going to hold your foot here, and your toes do kind of curl in, so that's good. And your toes curl in. Here is where I would do the cremastic test, where you would hold the scrotum and then have them cough and see if there's a reflex there, but we're not gonna do that. Okay, so I'm gonna have you lay down. And I'm gonna test your abdominal reflex. And then also while you're laying down, I'm gonna do the light sense and sharp dull sensation that I didn't do earlier because he was not laying down. So I'm just looking for your abdomen to kind of tighten when I do this. So very good, very good, very good, very good. And you're a little ticklish, I can tell. Okay, so now I'm gonna do light sense. So I need you to close your eyes and I'm gonna touch you in various spots on your abdomen and I want you to tell me now when you feel it.
Now. 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 Now.
Very good. Now we're gonna do the same thing with sharp dull, just like we did earlier. I want you to tell me when you feel sharp or dull sensation. Okay.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Very good. And you can feel sharp and dull sensation equally bilaterally on your abdomen. Okay, and so then the next thing that I'm gonna test for, actually I'm gonna have you sit up, I'm gonna ask you a couple of questions. We're gonna do the Glasgow Coma scale, and this is just kind of checking for your consciousness, your cognitive functioning. So first of all, I just want to point out that I'm noticing your eyes are spontaneously opening and closing. So I'm going to give you a score of 4 for that. And then now I want you to tell me where you are.
At your house.
Okay, very good. I need you to tell me what the date is today.
11/24/20.
Very good. And who's the president?
Donald Trump.
Okay, so you're oriented to time, place, and person, and so I'm going to give you a score of 5 for that. And then I also need you to, can you raise your arms for me and lower them? Okay, and so that is a response that I'm looking for, and so I'm going to give you a 6 for that, so his Glasgow Coma rating would be a 15. Okay, and then I'm going to have you go ahead and lay back down, and the last test I'm going to do 2, and this is testing for meningitis. So the first thing I'm going to do is the Brzezinski's test. I'm going to lay my hand right here and I'm going to hold your head up and I'm going to pull it forward, and I'm looking for any sort of flexion of the hips or knees, and I don't see any. And did you feel any pain when I did that?
Nope.
Okay, so now I'm going to do the Kernig's test. And this, I'm just going to bring his knee up to a 90-degree angle, and I'm looking for any sort of resistance or pain when I'm straightening his leg out. So are you feeling any pain?
No.
Very good. And I'm going to do the same thing with this leg. I need you to bend it a 90 degree. Oh, you're fine. I'm going to extend it. Do you feel any pain or tenderness? Good. And there was no resistance there that it shouldn't be. So you had a negative Kernig's test and a negative Brzezinski's. So he does not have meningitis. And that concludes our neurological assessment.